So pain, what's associated with pain? It's associated with depression and an earlier death. So those that suffer from chronic pain are twice as likely to suffer from major depression than those who do not have chronic pain. People with chronic pain die on an average of 2 to 5 years sooner. So chronic pain, if it's not properly treated, and lasting condition can take place in the peripheral nerves, the spinal cord, throughout the body. And it starts deteriorating. And of course, the treatment is when they treat it, you actually become desensitized. So you need more drugs and more drugs. And then because I believe disease travels in packs. If you have one disease like a wolf, you see a wolf, you know that there's other wolves somewhere because they travel in packs. And disease travel in packs too. If you have one disease, usually there's others that are ready to surface. And so the way the prescription business works in allopathic medicine is they treat that condition. They can treat that condition and it morphs into something else, and they treat that condition and they treat it in packs too. And so the patient becomes weaker and weaker and weaker and more toxic the more they're getting treatment. So chronic pain sufferers are also twice as likely to commit suicide because there's no hope. There's two outcomes really when you go for chronic pain. When you go there, you say, well, I have chronic pain. Well, they either dismiss it because it's not something that's normally visible, or they drug you. It's the two choices. Go ahead. Now, women, on one hand, are discounted much quicker than men when doctors go in. For some reason, they're discounted. And men will usually go out with a prescription. A woman will go in for something if she has chronic pain for something within the mind, to relax her, to help her sleep, or to take her mind off it, but not try to dealing with the issue. So and women experience pain more than men. So there's because of this invisibility, then there's no blood tests. Then they either think they're cheating the system to try to collect somewhere, or they are drugged, one of the two. So now, what is the drug of choice? The drug of choice is opioids. This is where you get the Oxycontin, and then you get oxycodone that they made now. Extremely addictive drug, of course produced by poppies, and this is my little thought process. That's probably why they never bombed Afghanistan, because that's the biggest poppy growing place in the world, and so that's why there's so much interest in Afghanistan. That's off the record. So there's the side effects are massive. I've seen people on Oxycontin. I've seen them in rehab centers, and it's not pretty. It's very, very sad to see that they shake. It's like legal heroin, and the pusher is with a prescription pad, and they think there's safety in that, and because they think that's how it's being administered, that it can't be that bad, or it wouldn't be approved, or it wouldn't be given. That's the deception. And so they get brought into that treatment modality, and they get sicker and sicker and sicker. They can't get off it. So oxycodone and cotton causes so many side effects, and the withdrawals are exactly like heroin. So you would get cold sweats, constant pains in the joints and muscles. So of course, if they pain, well, you get painkillers, more painkillers. Go ahead. Now they've said that if there was a cure, a natural cure for chronic pain, it'd be a gold mine. There is a choice, but the people don't know, the public don't know. People that come to community natural foods, they come there for a reason, because they want a better lifestyle. They come for choices without the side effects. And this is a wonderful thing. And we are here, just almost like the impact we have is maybe minuscule compared on the large scale. But we are making an impact. Each one of us are advocates of changing the health of individuals. And this is, and I can't stress it enough, you can help one. It's been worthwhile. And we've helped thousands and thousands. I don't think there's a stadium that could hold the people that have been actually relieved from pain or disease process by using the products that we've manufactured over the last 28 years. So absorption, now I was talking about how the products absorb. And I like to use this illustration as a lock and key. We have locking mechanisms in our bodies that are for our protection. The blood-brain barrier, passing through the intestinal walls. We have these barriers that are set up, and we have products that can actually penetrate this and get in there as a receptor site, but they have to be designed to do so. It's just not automatic that you have a calcium and it's going to absorb into the bones. It's not the way it works. It would be wonderful if it was that way, but there's a lot of differences out there. And this is where I say to design something for a receptor site to open up, you have to have the right key to open that lock. And this is how we design our products, so they are bioavailable to the cells. So that's how I formulate these products for cellular delivery. Now, the first product that I would like to talk about today is DMSO, dimethyl sulfate oxide. Does everybody know DMSO? Are you familiar with DMSO? DMSO is the methylation group, and the methylation group is one of the most common chemical processes in the body. Now, DMSO is treated for detoxification, or not DMSO, but the methylation group are for all these conditions. So detoxification, neurotransmitters, protein synthesis, for helping the body, reduces inflammation, protects the mitochondria, restores the level of SAMe in the spinal fluid, and required to make coenzyme Q10 and restores muscle mass. Go ahead. A DMSO is an organic sulfur compound, a metabolite and mother compound to MSM. It's naturally produced from trees, and it's very green. It actually goes back to the ground and actually helps with the carbon footprint. It's an amazing product. We are the only company in Canada with a license for DMSO. We applied immediately after it came off prescription drug status. It's an amazing transporter. It will do things that I can go into briefly what we can do, but that book, if you read that book by Dr. Morton Walker, you'll see how actually powerful this product is. Extremely powerful. The DMSO has so many things that it's such a fascinating product. It'll actually penetrate the skin up to 7 layers, go right down to the bone layer. It'll actually take away calcium deposits. It will help to bring the blood flow to that area, almost like a localized niacin flush in that specific area. And it starts to heal that tissue almost immediately. Because it's the most powerful painkiller, natural painkiller on the market today, natural one. So it can be taken internally, but we don't have a license to say that. The book will tell you how to do that. So it's a natural painkiller transporter, and it goes deep into the skin tissue. So we have the label claim relieves minor burns, including sunburns, assists in healing of the wounds and burns. Comes in 2 or 4 ounce jar, strengthens the immune system and detoxification. There was a study in Netherlands that found that DMSO provides 50% more overall improvement for patients with complex regional pain syndrome. Complex regional pain syndrome is this, usually is affected by your joints. Usually starts in the hands or the legs, and then it gets into an inflamed state, and it gets very swollen, and the pain becomes incredible. It's just an incredible pain, and then it starts to spread through the body, and it's not uncommon that it can go up to 90% of the body with this condition, and this product can actually help that. And that's one of the medicinal claims for this in the studies. So it helps to reduce the pain of reflex sympathetic dystrophy. So this is dealing with all different layers of pain. So reduces, this is our label claim, reduces pain associated with musculoskeletal conditions of the large joints such as post-traumatic soft tissue injuries, acute bursitis, strains, and sprains. And so I recommend when you use it to use it sparingly. It's a very powerful medicine. So don't rub it on. Like if you take it home for your husband or something, you want to put it all over his back, oh boy, he's not going to like you very much. It becomes almost very prickly, and it's like, it's very uncomfortable for about 10 to 15 minutes when you use a lot. So smaller amount and work your way up. Once you work your way up and you'll start getting the relief, and you'll find the benefit of using the product. It's incredible. These are things that could be expected. So DMSO liquid, 8 to 12 milliliters 3 times per day, but this is after you have found your comfort zone. You're ready. Your skin has been ready for it. You see how it's going to affect, and then you start to apply it this way. And so you do not rub it in. We've had people, we get so many phone calls on DMSO. It's the one product that people don't understand. They just think, well, I'll just put it on and it's going to just work like this. Well, no. It has to be a respected product. You need to have clean hands, clean surface, because anything you have on your hands is going to be transported 7 layers into the skin, so it has to be clean. Yeah, it's great to work with another product, and I'll go into that in a few seconds. It freezes at, I think, or crystallizes, doesn't actually freeze, at about 17 Celsius, boils at 189 Fahrenheit or Celsius, and so and it will actually start to crystallize. If you leave it in your car, like in a day like today, it'll start to crystallize, and you'll think it's not good, but just leave it in room temperature, it'll go right back to its regular condition. They found that at an Arctic expedition, they used this, put it on the extremities of the hands and the feet, and people would go out in -40 in the tundra, and they would not get frostbite because it does not freeze the tissues. So they actually use this for cryonics and preserve organs, because it will not, it does not crystallize it, so it can preserve the organ. So it's what they classify it as a class 3 chemical. Class 3 chemical is the safest chemical that's known to the pharmaceutical industry. So they use it as a transporter for several drugs. Chemotherapy is one that you normally use with it, because it takes it directly to the site. So the applications are massive, and we're very excited to have this product and introduce it to the natural health industry as an alternative to the prescription drugs